Hello, ladies and gentlemen. Welcome to Triple N Media COVID 19 World News Update. I am Dr. NIK NIKAM. This is November 14, 2020. The main topic today is monoclonal antibody, Bamlanivimab. I hope you can pronounce it better. Before we proceed with the feature presentation, I would invite you to take a look at my book on COVID-19 pandemic on Amazon.com, which has a comprehensive review of COVID-19, an indispensable guide for all leaders who are dealing with the COVID-19 pandemic. So let us continue with the feature presentation. As we speak, there are more than 53 million people across the globe who have been infected with the coronavirus, resulting in 1.3 million deaths. And here in the United States, we have more than 11 million cases of coronavirus with 248,000 deaths. There has been significant improvement made in the therapeutics and treatment of COVID-19. Just this week, we had two great news. One from Pfizer, which showed promising results with its vaccine, and the second one we are going to be talking about is the monoclonal antibody by Eli Lilly, Bamlanivimab, which was just given emergency use authorization by the FDA. The United States government has purchased more than 300,000 units to be distributed in concentrated areas to reduce the number of hospitalizations. What is Bamlanivimab? It is a recombinant neutralizing human IgG1 monoclonal antibody known as MAB. It is directed against the spike protein of coronavirus. It is designated to block the viral attachment and thus prevent the entry of the virus into the human cells, especially the alveolar epithelial cells and the arterial or endothelial cells. Here is a picture showing the site of block. As you can see, the coronavirus has this central core with these spike proteins. The monoclonal antibody blocks these spike proteins from attaching it to the ACE2 receptors, thus preventing the virus from getting into the cell, replicating itself, and in the process destroying the epithelial and the endothelial cells. I would just say BAM for simplification. The BAM was tried in 4 different groups in the Blaze 1 study, where they tried 101 patients with a dose of 700 milligrams. The second group was 107 with 2,800 milligrams of BAM. And the third group was 101 with 7,000 milligrams. And they had a control group of 143 patients. Here are some of the outcomes. The main outcome was a reduction in the viral load at day 3 and day 11. As we can see from this complicated slide, the main thing we want to focus is on day 3 in the placebo group, there was a 15% reduction in the viral load, whereas in those who received the monoclonal antibody, there was a 42% further decrease in the viral load. The secondary endpoint was hospitalization, which was noted in 5 patients out of 309 in the treatment group compared to the placebo, where the admission rate was 9 per 143 patients. So there was a reduction in the number of hospitalizations among those treated with this monoclonal antibody. Based on that, the FDA has given emergency use authorization in patients with a recent diagnosis of COVID-19 with mild or moderate symptoms for 1 to 10 days, and those who are having high risk profile, such as those over the age of 60, 65 with hypertension, diabetes, heart disease, and obesity. It is administered as a single intravenous infusion of 700 milligrams of Bamlanivimab. It is done in an outpatient setting, and it is not useful in those needing supplemental oxygen. BAM is not authorized for use in patients who are hospitalized due to COVID-19, those who require oxygen therapy due to COVID-19, or those who are already on oxygen require increased concentrations of oxygen to maintain their oxygen saturation level. In fact, when this BAM was used in patients who were hospitalized, they had more adverse outcomes, and hence it is not recommended for those patients who are hospitalized and those who require oxygen supplement. The adverse effects related to the Bamlanivimab compared to the placebo group were less than 5%, and most of them were mild, like nausea, diarrhea, dizziness, headache, pruritus, and vomiting. Since this is a foreign protein being introduced intravenously, there is a potential for a serious hypersensitivity reaction, including anaphylaxis with administration of Bamlanivimab. If someone develops any of these reactions, it is important to immediately discontinue the administration and initiate appropriate medication and supportive treatment for hypersensitivity reaction. Some of the side effects that you can expect due to severe allergic reaction could include fever, chills, nausea, headache, throat irritation, rashes, myalgia, dizziness, and in very, very rare cases, bronchospasm, hypotension, and angioedema. But in the study group, none of these patients had this type of a severe reaction from what I could recollect. In conclusion, Bamlanivimab is a recombinant neutralizing human IgG monoclonal antibody directed against the spike protein of COVID-19 virus SARS-CoV-2. It is designed to block the viral attachment and entry into the human cells, thus prevent any damage to the lung epithelial or endothelial cells. Ladies and gentlemen, you have been listening to a presentation on the first monoclonal antibody which received emergency use authorization in patients with mild to moderate symptoms in an outpatient setting, and this has been provided by the United States government free of cost to the patients. Before I conclude, I would once again invite you to take a look at my book on COVID-19 pandemic on Amazon.com. Please leave your comments. This has been a presentation of COVID-19 World News on monoclonal antibody by Eli Lilly, Bamlanivimab. I am Dr. NIK NIKAM from Houston, Texas. And please do subscribe to our YouTube channel.